I'm going to show you today how to draw up Meriofert in a multi-dose vial. Make sure your hands are clean. Everything should be prepared inside the box for you. Inside you will find a syringe of water with a needle, some powder, and another box with your individual dose of medication needles. Keep the needles for the next day. Open your water, which has a safety cap on it, which can now be removed. You can then attach your needle, twist the end off, and attach it to your fluid. There is some air inside. Just push that very gently to the top of your syringe. The blue cap can be flicked off, and the water is now going to go inside the powder. The powder will dissolve instantly, and this makes up 900 units of Meriofert injection. Your syringe can now go in your sharps box. When you open your next needle, it has your dosing down the side. If you are on a 300 dose of Meriofert, you need to now draw up fluid to the 300 mark. Take the cap off very carefully, and now pop this into your vial. Turn the vial upside down and draw up to your 300 line. Do make sure you check which dose you are meant to be taking. You will probably draw up a little more than the 300, so just very carefully inject back into the vial until the black line is at the 300. Take your syringe out, and this is going to go into your lower tummy, anywhere between your knicker line and your belly button, straight in at a 90-degree angle. Inject the full amount into your lower tummy. Hold the syringe there just for a couple of seconds. Withdraw and place that into your sharps box. The remainder of your medication can now go safely into your fridge until tomorrow. If you're on a 300 dose, for example, this has now got 2 more doses in it, and we will advise you on what your dose is and how much to give each evening.